Hi, my name is Penny Abernathy. I am part of Group 6 along with Linda Ard, Michael Castellanos, and Brandon Sewell. We chose our topic of medical marijuana. I want to start by telling you the history of medical marijuana, the benefits, the process of approval, and the states that have already approved legislature and the diagnosis for which that legislature was approved. Some of the terms that you're going to hear throughout our speech are going to be medical marijuana. Medical marijuana refers to the use of cannabis and its constituent cannabinoids to treat disease or improve symptoms. Marijuana plant, which is a tall annual plant known as Cannabis sativa that is native to Central Asia. Marijuana, which is the illegal street drug version of dried crumbled parts from the marijuana plant. Cannabinoids is any group of closely related compounds that include the active ingredients of cannabis or THC. Hemp, this is the fibers of the cannabis plant extracted from the stem used to make rope, stout fabrics, fiberboard, or even fishing nets. And hash, which is the resin that is collected from the flowers of the cannabis plant, with the primary ingredient being THC. The history of medical marijuana. It dates back as far back as what we found was 2737 BC. Emperor Shen Nong of China, who was also a pharmacist, wrote a book that he included the medical benefits of medical marijuana. Some of the benefits that he talked about in his book were to help with constipation, gout, rheumatism, and absent-mindedness. Now, in 1553, King Henry VIII compelled landowners to set aside 0.42% of their tillable land for the growing of hemp. He took this very serious, and the landowners that refused to use their land, the tillable land, the good land, to grow hemp, then he would actually fine them, and it was very strictly enforced. In 1842, Irish physician O'Shaughnessy published cannabis research in the England Medical Journal. And then in 1850, cannabis was added to the U.S. Pharmacopoeia. This was actually very significant because the Pharmacopoeia is a book that is published annually in the United States, and it contains the legal standards for the identity, the strength, the quality, the purity, packaging, and label of all drugs in the United States. So that was really very significant. In 1893 to 1894, the India Hemp Drug Commission's report was issued, and it showed that between 70,000 and 80,000 kilograms per year of hash was legally imported into India. Now, some of the myths about marijuana, the street drug version is some people consider to be the gateway drug, and there's a fear that if medical marijuana became completely legal, that it would be a gateway drug also. But what a lot of people don't realize is that a lot of the drugs that are considered street drugs are actually viable and usable in our prescription drugs that people use on a regular basis. For instance, OxyContin is a prescription drug medication for pain, and it actually contains cocaine. Ritalin, which is a widely prescribed medication for ADHD for kids, contains methylphenidate, which is a derivative of the street drug methamphetamine. Another myth about medical marijuana is that the only way to use marijuana is by smoking marijuana, and that's not true. Medical marijuana can be used in many forms. It can be used as an injection, a patch, it can be in capsule form, oil sprays, tincture, and salve. Currently, in Texas, there are several clinical trials that are going on, and for medical marijuana to treat diseases. Some of the diseases that they're trying to do the clinical trials for include cancer, glaucoma, Tourette's syndrome, inflammatory bowel syndrome, post-traumatic stress disorder, lupus, and Parkinson's disease. Now, there are several steps and stages of approval in the clinical trial process. They often start out at a cellular research level, and then as each stage is approved, then they can progress farther and farther. Phase 1 trials actually involve human trials. Now, the human trial process side for medical marijuana is actually a very slow process because marijuana is still considered a Schedule I drug, which means that it's highly addictive with considered not to have any medical value. But then again, that is the purpose of these clinical trials, is to show that they do have medical value and to prove that it's not going to harm and that the benefits of it outweigh, any side effects. There are 41 states so far that have passed legislature involving medical marijuana. We want to tell you about some of the states here around Texas that have approved it. Texas, within, I think it was about a month ago, I know it was in the last 3 months, actually approved cannabis oil for intractable epilepsy. Oklahoma has approved it for pediatric epilepsy. Louisiana has approved it for cancer patients that are currently undergoing chemotherapy, for glaucoma, and also for spastic quadriplegia. Mississippi has approved it for intractable epilepsy. New Mexico has approved it for Alzheimer's disease, Lou Gehrig's disease, cancer, chronic pain, Crohn's disease, Huntington's disease, spinal cord damage, glaucoma, and hepatitis C. Now, just like any other medications, there's like the task force, that's going to come around. They're going to make sure, that they're using the medications properly. They have to have prescription for the medications, that type of thing. So, in conclusion, we want you to understand the history of medical marijuana. We want you to understand that there are a lot of misconceptions out there about medical marijuana based upon what people know about the street drugs. So we wanted to try to clear that up and distinguish the difference in the two. We wanted to tell you about the process for getting it approved, and then we also told you about the states that have approved it. And out of the 41 states that have approved it so far, there is current legislature trying to get it approved in the other states. But as we said, as of right now, it is approved, some type of legislature in 41 states. So, hope you learned some interesting facts.